Hey guys, welcome back to my channel. I'm Michelle. A lot of you have been following along on my bariatric journey that started on September the 3rd. So I am a little over 6 months out. I am down 75 pounds, which is amazing. Feeling great. I still have completely regular blood pressure every time I go to the doctor. Doing really well. I'm in a stall and I cannot get to where I need to be to Wonderland. I am 4 pounds away from Wonderland right now, and it's so frustrating. Been in a stall for a couple of weeks. It seems to be moving, but this is kind of what we anticipate when we have bariatric surgery, is being able to take a picture of that scale that shows that you're underneath 200 pounds. So for anybody that's just now tuning in, I am 5'8", I am 51 years old, and I started, my high weight at this journey was 285. I was about 266 when I started all of this, and now I am at 204. So I'm doing really well. Staying committed to getting my protein in. I am not on a no carb or low carb or keto diet. I have high cholesterol that runs in my family, and for anyone who can maintain keto, that's great. Whatever works for you. I have a lot of friends that are doing keto and they're doing really well on it. It's not something that is maintainable for me. It's something that I've tried before. I don't do well without carbs. I do try to eliminate sugar. Very rarely do I have real sugar. The coronavirus right now has made it a little hard to find sugar-free creamer, so that's a little frustrating, but it's not gonna kill me. Not the coronavirus either, you guys. Let's see. So complex carbs are very important to me. I've switched my family over to high protein spaghetti. I also do zoodles, zucchini noodles. There are some really good frozen vegetable based noodles in the frozen section of your grocery store right now. Obviously with COVID-19 going on, it's going to be a little bit more difficult, but they are vegetarian, so I was able to find several at Target a couple of days ago. My Target here wasn't quite so bad. I have been able to get toilet paper from Amazon. I've not had any issues with any of that. I am a registered nurse, and we were born for this. We do well in these types of situations. I can tell you that coronaviruses are not new. If you look on the back of your Lysol can, you will see that your Lysol kills a human coronavirus. That's because they have existed before, and there have been freakouts like this before in the United States and in other countries. There was SARS in 2003, completely eradicated by 2004, no additional infections post 2004. There was MERS, which was Middle Eastern, and I don't recall if that got to the United States or not, but your healthcare professionals, your doctors, your nurses, the majority of us you're going to see are not freaking out about this virus. We understand what it means to flatten the curve. And what that means is the fewer people that you're around, the more that we can get rid of this virus. It is a virus. It does not respond to antibiotics, so that's not going to do any good. What I will tell you is a lot of the people that are very, very sick or are losing their lives develop pneumonia from this. They go into respiratory distress, and it's very important for you guys to understand the signs and symptoms of pneumonia and the signs and symptoms of this virus. If you are running a fever, if you have any tightness in your chest where you feel like you can't breathe, those are symptoms of COVID-19, and they are also symptoms of pneumonia. So it's very, very important that you not overload your doctor's office, that you not overload your urgent care facilities, because they are not going to be able to help you. They are not going to be able to test you for COVID-19, and they are not going to be able to treat you very well for pneumonia. They can do a chest x-ray, but they're not going to be able to do the things that need to be done to identify what type of pneumonia you might might be suffering from, if it's bacterial or if it's viral. They're not going to be able to do CT scans in most instances. So if you are having these symptoms, I encourage you to go to your emergency room. Masks. Let's talk a little bit about masks. The standard flu and things. The flu is also a virus, and you'll see people wearing the masks at the hospital that you can get at the desk. What I can tell you is that those are not N95 or N99 masks, and those are the ones that actually block out viruses. So while I like to see people wearing masks, especially during flu season, with this pandemic that's going on, there hasn't been a pandemic in a very long time. The regular masks are just not gonna do it, and I'm being super honest with you guys. N95 masks right now are impossible to find. Hospitals are having trouble keeping theirs stocked, and they're having to lock them up. They're having to lock up hand sanitizer, which I do not understand. This is the strangest thing that I have seen in my 27 years of being a registered nurse. So quite odd. I would encourage you guys to make sure that you're not reading fake news and that you're not reading fake stories, that you're getting advice from your medical professionals, and that you're accessing accurate information, because the chaos is even worse than the virus. And social distancing is important. Stay away from people. Don't go to gatherings with more than 10 people. I'd suggest not going to gatherings with more than your family, honestly, right now, 3 or 4 people or 5 people, until we can get this under control. Human testing is underway for vaccine. Our scientists are working very hard. Our medical professionals and our first responders are exhausted right now. So be a little kinder to each other. Be appreciative of the people that are working so hard to try and get this under control across the world, multiple countries. It is no one's fault that this happened, but be good to each other and follow the rules. Don't be a rule breaker. It's really, really important that you keep your health under control. Excuse me. As you guys know, I've been sick on and off. I don't have COVID-19. I can tell you that this is a wet cough, and there's a big difference between a dry cough, which is the symptom of COVID-19, and a wet cough. I had a pulmonary embolism again in January, so I have serious lung problems anyway. I am immunocompromised from multiple sclerosis, so I am at very high risk of getting seriously ill from coronavirus right now. So I'm trying to do as much social distancing as I can. I don't live in fear. I know that we'll get this under control across the world and everything's going to be okay, but I've been fighting bronchitis for the last about 2 weeks. Antibiotics have helped, and then it is severe allergy season in Texas too, so it's like a quadruple whammy. All of our kids are out of school. We did have a child in our school district test positive, presumptive positive here, so our schools are closed down right now until April the 3rd. So my 16-year-old daughter is home, and they're doing e-learning at school. So that's been interesting. She's getting her work done, and it's really kind of sad for seniors this year, because there's the possibility some schools in Texas have already closed down for the rest of the year, and the seniors aren't going to get to walk the stage. So it's really kind of sad when you think about it. There's a lot of disruption going on for people's work. Restaurants are closing. People are losing their jobs. So if you're the praying type, lift people up, lift our scientists up and our medical professionals, that we find a way to get this under control. I ask that you lift up our leadership and our president, as he's working very hard to help get this under control too. You guys have no idea what it takes to handle a national crisis like this. And there's a lot of people out there that are super quick to criticize our presidents over the years. I've seen criticism of President Trump. I saw criticism of President Obama when H1N1, which was by far much, much worse than what we're dealing with right now. I've seen lies posted about him, that he didn't respond for 6 months to the H1N1 situation, and that is also incorrect. He declared a public emergency and then a national emergency in a similar time frame as President Trump did. George W. Bush had to handle September 11th, and there was a lot of criticism for him. So I encourage you to stay out of politics with this kind of stuff going on. People are sick, people are dying, people are scared, and it's not our president's fault. That's all I'm going to say. It's also not China's fault. I see a lot of bigotry going around. It has nothing to do with China. The conspiracy theories should stop. It's one of the things that frustrates me as a medical professional is to see stuff like this circulating, because it's fear-mongering, and it's causing little old people that are at risk for this, or immunocompromised people like myself, or parents that have immunocompromised children, to freak out. And we are trained as medical professionals to keep an even keel, keep things under control. I'm only sharing what I know for sure is accurate right now. And that's important too, because people do read what you share on social media. So it's important that you look into those things and have a social conscience when it comes to that kind of stuff. I'm not trying to preach. I'm just letting you know that this is not the first time I've seen an epidemic like this, or a pandemic, and it probably won't be the last. So hang in there. Things will get better, I promise. As far as my bariatric surgery goes, I am doing really well. I haven't stretched out my stomach. I'm still getting my protein in every day. I'm able to tolerate more foods now, which is great. I was really struggling for a long time there and living primarily on protein shakes, which isn't good. Taking my vitamins has been important. I've switched over from the bariatric chewables to just a regular vitamin now, because I can just take it with water. It's just easier for me to remember to take with my other medications. But overall, everything's going really well. My whole demeanor has changed. My health is 100% improved. I'm wearing clothes sizes that I never thought. I'm in regular extra large clothes now. I bought a jumpsuit for a function that I have next month, and it's a regular extra large. It's not a plus size, and it's super cute. I'm alternating between a 12 and a 14 in my jeans, which I haven't worn a 12 in over 25 years. So it's very shocking. This is a large shirt, and it's quite big on me. For the ladies, we lose in the bust first, so I've gone down 3 bra sizes, which is insane, both around the band and cup. So underwear, I've had to buy all new underwear. My feet shrunk, so I've gone from wearing a 9 to wearing an 8, and sometimes even a 7.5 now. So you don't really realize where you carry weight on your body. My neck, this is crazy. Like, this is a necklace that I couldn't even wear. It was like a choker on me 6 months ago, like this, and now it hangs loose. So there's a lot of things that change in our body after we have this surgery, and I feel amazing. With the exception of an allergy cough and wrapping up the end of this bronchitis. But hang in there, you guys. If anybody has clinical questions for me, I'm happy to answer those for you offline. I am not a physician. I'm not trying to be a physician. But if you have questions for me, you can get in touch with me on Instagram. Drop me a note below in the comments and just let me know that you have questions, and I'll do my best to answer them for you over on Instagram. My Instagram is gastric_sleeved_superwoman, and I'll put it down below. Please subscribe, turn your notifications on if you want to keep up with my videos. I apologize again. I really would love to post a video every week, but it has not been feasible, especially with this virus going on since January. Actually, even probably before then. It has been crazy busy. I have been sick. I was hospitalized in January. I'm trying to stay well and to help people, and we're working crazy hours. So just be patient with me, and I'll keep you guys updated on where I'm at in my journey. Hopefully the next video that I post in the next week or so, 2 weeks, I'm just trying to be honest here, I'll be in Wonderland, and I am so looking forward to that. That is an NSV that I just can't wait for. So I hope you guys are doing well. If you have questions or comments, please put them below. Subscribe, turn your notifications on, and I hope you guys are doing great. Have a good week.